Hello, lovelies. I hope everybody has had a wonderful Christmas, wonderful New Year's, and I am happy to be back, happy to be recording. I feel like I've got so much that I've had on my mind, wanted to say, but also just needed to step back and take a break. Yeah. Wanted to talk to y'all today about GLP-1s. So, GLP-1s are like all the rage right now. Everybody knows what they are in a sense, but maybe you don't know exactly what they are. So, all of a sudden, everybody's getting skinny and you're wondering what they're doing. And I think that has a big part of all of that. So, let's just dive right in. So, GLP-1s are glucagon like peptide ones. And they're powerful hormones that play a really important role in regulating our blood sugar. They help control our appetite and support weight loss. People on the shot, that's usually what you hear, and that's why everybody is slimming down. But there's pros and cons, like all medications, right? We're going to talk about that too. But first, we're going to talk about what's out there and which ones you've heard of. There are GLP-1 agonists that are currently available. And these are the ones that mimic the action of the natural GLP-1 that you have in your body. So they do help with blood sugar regulation and weight management. These are going to be things like Ozempic or Wegovy or Rybelsus. Some of these are used for weight loss, like Wegovy, and then some of them are used for type 2 diabetes management, like Ozempic. You have to have a certain diagnosis to get on some of these. You can't just go to your doctor and ask for them. So, per the U.S. Food and Drug Administration, aka the FDA, it has approved several GLP-1 receptor agonists for managing type 2 diabetes and, in some cases, weight loss. I am summarizing what the FDA website says and will link my sources in case you want to go back and read them. But this is all from December of 2024, like last month, y'all. But type 2 diabetes management, there are certain ones like Victoza and Ozempic that are approved. You have to be at least 10 years old with type 2 diabetes and have to also do diet and exercise. So your provider has got to emphasize diet and exercise along with you taking this. You have to be at least 10 years old. Let me just pause right there and say, if there is a 10-year-old out there with type 2 diabetes, we have some problems. Okay? That's ridiculous. That's ridiculous. Okay. Now, for weight management, there are some GLP-1 receptor agonists like Wegovy and Saxenda that are approved for chronic weight management, not weight loss, okay, but weight management in adults with obesity or overweight conditions, particularly those with related health issues. If you're overweight, then Wegovy would be the one that you would get unless you're overweight and have type 2 diabetes. So you have to have that diagnosis of type 2 diabetes also to be on Ozempic or Victoza. Your doctor's got to have that diagnosis code in there, all that good stuff to prescribe that for you. Okay. And then the FDA website goes on to say that the FDA has expressed concerns about certain companies illegally selling unapproved drugs that contain like the real chemical makeup medication. What I've been talking about, Wegovy, Ozempic, all that, y'all, that's the brand name. That's the one that y'all are more familiar with, probably. So that's why I'm mentioning that. But the chemical name of it is semaglutide. So all of those names, there are some companies out there that are illegally selling them for research purposes. And I've seen it myself, certain websites where you can go and order this stuff online. And I highly advise not doing that because those products, they're really of unknown quality and they can be pretty harmful. The FDA, along with myself, urges consumers not to purchase or use these unapproved products. But then their FDA also says, this was from August of 2024, that they were evaluating reports of suicidal thoughts or behaviors in patients taking certain GLP-1 receptor agonists. So while these medications were effective for blood sugar and weight management, they said it's also really important for your healthcare provider to monitor for any unusual mood changes, which is very interesting. Personally, if you think about that, I just think about how the gut is influenced by it all. Remember, we talked about the GLP-1s being released from the intestines, and your mental health has so much to do with your gut as well, because you do have that gut-brain connection via your vagus nerve. And the more imbalanced that your gut is, the more likely you're going to have depression, anxiety, suicidal thoughts, all of that kind of stuff. So if somebody's on this medication and it's just secreting a lot more GLP-1s, maybe somebody already had a lot of anxiety or depression at baseline. This could definitely amp it up. I could see that. It could definitely cause some problems. And then in December, the FDA did approve. I don't know if it happened in December, but it does say that they had approved some generic versions of once daily GLP-1 injections. So the most of the ones I talked about were like weekly injections, but apparently now they do have daily ones that people can use if they have type 2 diabetes. So that's very interesting. However, all the gut issues that encompass it are very intriguing. And I will say too, the FDA says these medications should be used under the guidance of a qualified healthcare professional, just like any other medication. But I definitely think that you should make your own informed decision. And I say this too because as somebody who did work in clinic and has been a provider, this is something that I've had to learn a lot about. It wasn't all the rage. It wasn't something that they taught us in school. So your provider may not be as familiar with it unless this is something that they are very interested in. And that's like with any medication too, y'all. That really is. Some prescribers are just more prone to prescribing a certain drug because that's more of their niche. If your provider, if you're going to them about this, I would make sure that there's somebody who has done their research, but I also encourage you to do your research. I really do. And make sure that it's up to date research. Oh gosh, this is just, it's all so interesting. And not everything that the FDA says is what I agree with or anything. By all means, I'm literally here just sharing with you the information and really hoping that you make informed decisions. If you're somebody who is wanting a quick fix, then this is what that is. I'm not going to sugarcoat it. That is what this is. Now, I think that there is a time and a place, certain people, certain conditions that you can use this as a great tool, just like I've said before. But you've got to make your own informed decision. And so I'm here to just share the if, ands, or buts, pros and cons, all that yummy stuff. Okay. So there are other brands out there of GLP-1 agonists, but the ones I mentioned are just the most common, most well-known, right, that we hear about. But they can be really effective, but it's really important to also take into consideration that your body makes these GLP-1s anyway. So there are natural ways that you can implement weight management and blood sugar balance without just taking this. So while medications can be really helpful, functional medicine and holistic approaches really emphasize like the power of lifestyle choices to optimize that GLP-1 function. So there are some natural supplements and foods that can help increase your body's natural GLP-1s and help secrete those more. So some of those supplements that act like GLP-1s are going to be things like berberine, chromium, probiotics, and omega-3 fatty acids. Those are just like 4 of the top ones. Berberine, chromium, omega-3 fatty acids, and probiotics. Okay. So berberine, you can get this in supplement form, but it's a natural compound that is found in so many different plants. And it's been shown to enhance insulin sensitivity, which helps blood sugar balance, obviously. And it increases the GLP-1 production that you already have. So therefore, your blood sugar is balanced throughout the day. Now, some of you might be listening and thinking like, okay, I don't care about blood sugar balance. I'm not a diabetic. I just want to get skinny. Okay, listen to me though. Like you have to, it doesn't matter if you're diabetic or not, like you have to pay attention to your blood sugar because if your blood sugar is all over the place, you're going to feel like crap. You're going to feel absolutely terrible and you're going to become insulin resistant, which is where you end up getting diabetes and gaining weight. Turn your ears on and pay attention. Chromium is the next one. And this is an essential trace mineral that's really involved in the metabolism of carbs and helps improve insulin sensitivity. So that's why it's great to help boost the natural GLP-1 production that you have in your body. Then you've got probiotics, which just are so great for your gut. It promotes a healthy gut microbiome, but indirectly, because of that, it enhances these GLP-1 levels. And then the omega-3 fatty acids. So that's what's found in fish oil. And omega-3s are anti-inflammatory, so it improves insulin sensitivity. So therefore, it helps with the GLP-1 function. So those are the supplements, but then there are other foods that can help support GLP-1 production. And those are going to be foods like healthy fats. So fat does not make you fat. You can't just, that's been such a bad rep, I think. In the 90s, it was like, oh, go low fat, low carb, low fat. And that really screwed everybody up because here we are and everybody is overweight and insulin resistant. And so many people have diabetes. So, anyway, healthy fats all the way. This is going to be in foods like avocados, olive oil, fatty fish like salmon. All of this helps stimulate GLP-1 production. So these healthy fats promote fullness. So you're not wanting to eat as much, and therefore it helps your blood sugar balance. Some other foods are going to be leafy green veggies that are also full of fiber. So kale, spinach, broccoli, cauliflower. I put spinach with everything. Even if I make a smoothie, I put spinach in there. Just try to get your greens in some way because these also help with GLP-1 production and secretion. Then there are fermented foods. So kimchi, sauerkraut, kefir, all of these contain probiotics, which we mentioned help your gut health. You can get probiotics from food or from supplements. Cinnamon is also a really great food to help support GLP-1 production. So it has been shown to improve insulin sensitivity. So put this in your coffee, smoothies, or sprinkle it on your oatmeal. Cinnamon. And then berries. I love blueberries. I have blueberries for breakfast like almost every single day. Blueberries, strawberries, raspberries, all of this, they're all so high in antioxidants and fiber. So that's going to help with your glucose regulation and therefore have this positive impact on the GLP-1 levels. So the last type of food I'm going to talk about today that helps GLP-1s, helps support them, is green tea. So green tea is really rich in polyphenols and has been shown to help with insulin sensitivity. So therefore, it also helps with GLP-1 production. So basically, GLP-1s, they're such an important part of our metabolic health and weight regulation systems that we already have in our body. So whether you're looking for medication or more natural approaches, the goal is the same. It really is. And it's to support your blood sugar levels, it's to control your appetite and enhance your overall wellness. So just to take a step back, I started this episode talking about GLP-1s, like what they are, all of that, wanting to lose weight. Everybody seems like they're trying to do that. Everybody got skinny for Christmas. But it all comes back to how you eat. It all comes back to how you treat yourself. And even if you are somebody who chooses to get on this medication and gets the shot, you still have to eat healthy like this anyway. I want y'all to understand that. So, like, you can't just go and start taking the shot and still eat junk. You've got to eat healthy either way because are you going to take the shot forever? Probably not. Why would you do that? Also, we don't really know the long-term side effects about what all that's going to do to you. That's a whole other thing. But either way, you're going to have to start adapting this healthy lifestyle. If you get off the shot and you haven't, you're going to gain all of that weight back. Either way, if you don't change your life, if you don't start eating healthier and implementing certain things that I've mentioned, then you're just going to head down the road of chronic disease. There's no ifs, ands, or buts about that. So the way that the GLP-1s work, whether they are like natural or it's in the medication form, they essentially have the same mechanism of action. But whenever food enters your digestive system, the GLP-1, remember, it's a glucagon-like peptide, and it's a really important hormone. It's released by your gut, by your intestines. And this signals to your pancreas to release insulin in response to the rising blood sugar levels. So, either way, whether you're a diabetic or not, you've got to pay attention to your blood sugar levels. But the GLP-1s also promote this satiety. It interacts with the brain and reduces those hunger signals. So, you're not going to be as hungry as much, not going to have all those cravings that you might have. But also, if you start eating better and heal your gut, you're going to get rid of those cravings too. Just a side note. So, in essence, it really helps regulate both of your blood sugar and appetite, making that a key player in weight management. And actually, experts like Dr. Mark Hyman and Dr. Chris Kresser, they really have emphasized that GLP-1s are influenced by our diets and our gut health. So it all comes back to that. So, for example, diets rich in healthy fats and proteins, which are very common recommendations from Dr. Hyman, and I recommend that to all my clients as well. This can naturally stimulate GLP-1 production because you're eating a lot of those healthy foods that I mentioned previously. This therefore enhances insulin sensitivity, supports fat loss. Now, Dr. Chris Kresser, he has had some work where he's talked about the gut-brain axis, and he really highlights that and how a healthy microbiome really enhances and improves the GLP-1 secretion. So then it reduces inflammation and promotes this metabolic balance. Then to go even further as far as like GLP-1s and metabolic health, Dr. David Perlmutter, he has spoken at length about hormones like GLP-1s and how they help us manage chronic conditions like diabetes and obesity. So whenever our GLP-1 production is really functioning optimally, this improves insulin sensitivity. If you haven't heard me already, it improves insulin sensitivity. I feel like I've said that so many times, but that's what it does. So this helps stabilize your blood sugar and potentially preventing or managing conditions like type 2 diabetes. So also strength training, which is something that I emphasize so much to all of my ladies, is also really important with GLP-1s because it improves GLP-1 sensitivity. Because exercise can naturally boost the production of GLP-1s, this also leads to better weight management and metabolic health. Now, I want to say this. I have heard from other providers in this area that I'm close to. They have had certain clients who have been on GLP-1s and come to them for different reasons. And they have seen such a drop in their muscle mass. So that's really scary too. So think about this. If you're taking these GLP-1s, but you're not changing your lifestyle to eat healthier or to strength train, and you're a menopausal, postmenopausal woman, or even after our 30s, essentially, is when our muscle mass starts decreasing. But you really think about it in the more wiser, mature ladies, we're losing all this muscle mass and it is affecting our bone health, our bone density. We're going to be more prone to fractures. We're not going to be as strong because all of our muscle mass is decreasing. We might be losing the weight, but where is it coming from? If we're losing it from all of our muscles, yes, we're going to be skinnier, but we're going to be pathetic. We're going to blow away when the wind blows. We're not going to have any strength at all. Quality of life here, guys. Quality of life. I don't know about you, but it's not worth it to me. It's not worth it to me. But I would say if you are somebody who is going to be taking a GLP-1, you want that quick fix, you better hit the gym. You better start strength training. And I'm not talking about these hardcore workouts. Please don't do that. We're not looking for more issues here with high cortisol and whatnot, but you're going to be losing weight fast and it can come from your muscle pretty fast. And I have worked hard to gain my muscle. Ain't nobody going to take it away from me. Muscle is the organ of longevity. The organ of longevity. Muscle mass, that is the key to longevity, long life, youthfulness. Look, that'll be in the next episode or something, okay, y'all, because I can just go on and on. Please make sure that you're just informed and doing what's best for your body and not just shriveling away, letting the medication eat all your muscle because that's just, it's so sad. It's so sad. But back to what I was saying, it's clear that these GLP-1s play a very important role in our health. But as other aspects, like I've said with functional medicine, like it's all about balance, right? And so medications might be the choice for some people, but optimizing your lifestyle factors, your diet, your exercise, your gut health, guys, that has to be the first step. It has to be. A healthy gut microbiome enhances GLP-1 secretion. It improves overall metabolic health. You can get these same results naturally and not lose all the muscle mass at the same time if you're doing all the right things. But by addressing the root causes of any kind of imbalances you have, functional medicine empowers you to really just be proactive about your health. It really does. The pros and cons, making informed decisions, that is what it is all about. Now for the pros and cons. So, the pros, obviously, we have heard some of those that I've been talking about, and that's going to be that it helps control your blood sugar. So, the GLP-1s, they improve how your body handles sugar. So, this is why it's really great for people that have been diagnosed with type 2 diabetes. Okay. Then it also supports weight loss because it reduces appetite, and this is really great for people who are trying to lose weight and who are struggling to lose weight and struggle with diet and exercise. Then there have been some heart health benefits. There have been a few studies that do show that GLP-1s may lower the risk of heart problems in people with diabetes. But side note, y'all, if you change your diet and lifestyle habits, that does the same thing, right? You're going to be at lower risk for heart problems, and diabetes because you're losing the weight and your metabolism is being affected differently. Whether GLP-1s are directly connected to heart health benefits, I would say it's a tool to get there. That's debatable. And then another pro of GLP-1s is that it reduces cravings. People are not going to be as hungry. They're not going to eat as much whenever they are taking these medications. So therefore, it's easier to not binge eat, that kind of stuff. So now let's talk about some of the negative things, the cons with GLP-1s. So the side effects cannot be so great for some people. So some common side effects are nausea, vomiting, diarrhea, stomach pain. So all kinds of gut issues essentially. And for some people, this can be just like mild discomfort. And for some people, this can last for weeks. So there's that. It also can be really expensive, and not all insurances cover them. It's you can either choose to do it the natural way, like I was mentioning before, where you're just paying the cost of healthier food and maybe a gym membership and that kind of thing, or take this medication that's really expensive. And then also a negative thing is that it's really temporary. You're only getting temporary results from these. So if you stop taking this medication, your weight and blood sugar levels are going to return to where they were before, unless you change your diet and lifestyle habits. It's going to happen. It's going to go back to what it was before. The other con I want to mention is that it doesn't solve the root cause. That's the thing. It's really a medication that's just covering up whatever the real problem there is. So if you're taking this medication, I'm speaking to diabetes and weight loss here, but they're not addressing those. They're not addressing the root cause of it. What's causing the diabetes? It's not diabetes that's the root cause. There's something that's causing that. Same with being overweight. And the root cause of these things are going to be poor diet, stress, lack of movement, sedentary lifestyle, things like that. GLP-1 medications are tools. They are not cures. And then the other con is that there is a risk of other issues. So there have been some rare cases where GLP-1s may increase the risk of thyroid tumors or pancreatitis, which is inflammation of the pancreas. If you do have any of these medications, or think about any medication that you've ever had before, there's like a pamphlet inside that tells you side effects, all that stuff. Most of the time, nobody reads it. If you open that up, it tells you all of this. it's really, do you already have thyroid problems? You might not want to take this too. Do you have a history of pancreatic issues in your family or pancreatic problems? You might not want to take this. You've got to make your own informed decision. And these are just some things that I like to point out. But the bottom line, though, is that GLP-1 medications, they can be helpful for managing, not curing, not healing, not getting rid of, but managing diabetes and losing weight. But it's not a magic pill. It's not a quick fix. But ultimately, they work best whenever you do combine them with healthy habits, eating nutritious foods, staying active, managing your stress. I'm a broken record over here, y'all. I'm a broken record. Always make your own informed decision. I do encourage you to talk to your doctor if this is something that you're interested in, but also do your own research. Don't just go off of one person's opinion or what they say. I would definitely look into this yourself to see if it's right for you or what the plan is besides just taking a pill or a shot, whether it's a pill for something or a shot. You don't ever just do it and go with the flow. You have to do other things too. There's not one magic pill, not one magic shot. So I'm going to leave you with that. I feel like that was just a lot of info. And I hope that this was informative and that you feel empowered. And yeah, just this year, take control of your health, make your own health decisions, and stay cool. Thank you for being a part of my journey on What the Gut podcast. For a deeper dive into today's topics, head over to allisonandwellness.com/whatthegut or find the detailed show notes linked below. Hey, and don't miss out on future episodes. Hit that subscribe button, and if you love this one, please leave me a review. Let's keep the conversation going over on Instagram. Connect with me and stay updated and engaged with my awesome community. Plus, share these valuable insights with your tribe. They deserve to feel as amazing as you do. You can find me at Allison_and_wellness on Instagram. Your support means the world to me. I'm looking forward to our next awesome chat. But until then, stay curious, don't drink too much coffee, keep the vibrant energy flowing, and take care of your gut. Catch you real soon. Oh, and hey, if you're ready to dive deeper into personalized wellness, check out my one-on-one health coaching program at allisonandwellness.com. Let's make your journey to holistic health truly transformative.